We go now to Laura Windsor, who has this report.
Cellulite isn't harmful, but many people would like to get rid of it because of the way it looks. There is a treatment called i-Lipo that is a non-invasive treatment for excess fat and cellulite. Dr. John Perlman, a plastic surgeon in Beverly Hills, explains i-Lipo and how it works.
i-Lipo is short for intelligent lipo, and it's based on a low-power diode laser that's been shown at very low power levels to open up pores in the fat cells to allow the fat, the triglycerides, to come out as free fatty acids, evacuating the fat cell. So the cell collapses, the body has the ability to metabolize that fat, and it's a method of directed body sculpting. We can decrease the circumference of an area where there's extra fat padding beneath the skin. A good candidate is not somebody who's grossly overweight trying to lose weight, because you don't lose that much weight from this alone, but somebody who's dieting and exercising but just can't get a good reduction in their circumference in a targeted area. Maybe it's the waist, maybe it's the thighs. Because it's been shown in FDA-approved studies that if you add i-Lipo treatments to a specific area while you're exercising and dieting, it probably quintuples the amount of fat reduction and circumference reduction and shaping of the body that you can achieve. So we want somebody who's really healthful, watching their calories, watching their food intake, and exercising to combine that with i-Lipo to get the best results. We can do it on the neck, we can do it on the arms, the trunk, thighs. Just one area we don't apply it to is the breast area. A patient who's receiving the treatment lies down on a comfortable table, we dim the lights, and we attach to their skin with an elastic band 4 plates that have about 9 little diode lasers in them. We make sure that their eyes are protected, and we also put 2 small diode stimulating pads over the adjacent lymph node area. So the patient feels essentially nothing. Once we start the machine, there's a red light essentially that's contacting their skin, maybe a slight sense of warmth, but microscopically, if you look with an electron microscope, within 4 minutes, 80% of the fat cells that are receiving the light source from the diode laser are deflating. They've opened a pore and fat's coming out. So visibly, there's not that much of a change. People shrink a little bit with even the first treatment, but now the body has the ability to burn some of those free calories if the patient exercises. Each treatment session is composed of 2 10-minute applications of the laser pads, the diode pads, and it's a painless, easy, effortless experience where most patients are checking their email or taking a little nap while they're receiving the treatment. There's no pain involved, and essentially there's no risk involved either. Usually it takes a few of these 8 treatments for people to start noticing some looseness in their clothing. If you do a measurement, even after the first treatment, there is some shrinkage that occurs almost immediately, but the real benefit is after a series of 8 treatments. Most patients have been very pleased with it. I think they have the responsibility of continuing to watch their diet, because those fat cells, though emptied, can still refill. So if they watch their diet, I think it's a long-lasting benefit, maybe not quite comparable to undergoing surgery, but without any pain, without any side effects or risks. It's very simple and very effective.